queen, she a vision. Pretty woman, beautiful woman, so fine, she causing confusion. Keep your head up, no look down. You say to yourself, you say, look at me now, you see me a baby. First class, baby, you know me status. Super icon, me no need to practice. Walk in the room, everybody wants this. When you see me coming, better bow down for me. Queen, don't come for a flower for me. I'm looking at a girl in a mirror, and here's what she said to me. She said, woman to woman, you're one in a billion. She a queen, she a vision. Pretty woman, beautiful woman, so fine, she causing confusion. Keep your head up, no look down. You say to yourself, you say, sure you want cause it's something. With the way you dey move your body, oddy. Fine girl, no be smarty. Boss babe, where they run things. Naughty, sexy girl, no they hide yourself. Not for nobody else. See the girl in a mirror. Here's what she said to me. She said, woman to woman, oh, you're one in a billion. She a queen, she a vision. You a pretty woman, oh, beautiful woman, so fine, she causing confusion. Keep your head up, no look down. You say to yourself, you say, can't you see me now? Cause I can't see you now. That you see me now. She a queen, she a vision. Pretty woman, beautiful woman, so fine, she causing confusion. Keep your head up, no look down. You say to yourself, you say, look at me now, you see me a baby. First class, baby, you know me status. Super icon, me no need to practice. Walk in the room, everybody wants this. When you see me coming, better bow down for me. Queen, don't come for a flower for me. I'm looking at a girl in a mirror, and here's what she said to me. She said, woman to woman, you're one in a billion. She a queen, she a vision. Pretty woman.
Hello, everybody. Welcome from wherever you are joining us from. My name is Sibulele Sipata Nomganga, joining you from Johannesburg in South Africa. Good afternoon, good morning, good evening from wherever you are. Thank you so much for taking the time today and joining us as we launch Her Voice Fund Country Profiles. Now listen, this has taken a lot of work, right? And I'm just so excited that today we get to share it with the world. Here's the thing though, we are not going to be able to share it with the world alone. We are going to need your help. Now, what I'm going to need you to do is to please tell us your name, where you come from, and where you're joining us from right now. Tell us in the chat box. Then as soon as you're done doing that, I'm going to need you to take a selfie of yourself, and I'll show you how to do it. I'm using my phone right now. And you're going to take the picture and you're going to post it onto your stories, onto your feed, on Instagram, Facebook, wherever it is that you are active. And you're going to give us the hashtags Y+ Global, and you're going to give us hashtag Viv Healthcare, hashtag Global Fund, and make sure that the world knows that right now we are doing something huge. So please go ahead onto the chat. I'm going to be reading out people's names. Tell us your name, where you come from as your organization, and where you are joining us from right now. So hello and welcome everybody. Let me go in and check who's here. Hello, Ravel. Hello, Mr. Pinampi. Hello, Simpiwe. Hello, Jacqueline from Tanzania. Hello, Tawanda. Yes, Pinampi is from Koroko Social Investment in South Africa. Hello, Lisa, all the way from Kenya. Hello, Alina from Namibia. What's up, Kevin, all the way in Kenya. Hello, Patricia. So happy that you are here as well. We Cabo Goza. Kenneth is a lot easier, but I want to know how to say this properly. Cabo Goza from Uganda. I hope I said your name right. Welcome. Thank you for being here. Hajati, thank you so much for being here from Uganda. Angela, thank you so much for being here from Lesotho. Macy from Kenya. Kate from Kenya. I hope I said that right. Bessie from Kenya. Oh my word, everyone. Thank you so much, Tosan Morag in London. Nice to have you here as well. Julio, because Portuguese from Mozambique. Shai. Nice to have you here as well. We have Emilia, or Ems, as I call her, from Cape Town, South Africa. We also have George from Tanzania. I could go on forever. Oh my word. Welcome, everybody. Thank you so much. Please don't forget to take that selfie, and please post it onto your stories, onto your WhatsApp, on any social media platform you're on, and let the world know that this is what we're doing right now. This is important work. And I'll tell you why it is so in a short while. But first, let me tell you who this is and why we are here. This is Her Voice Fund launching the country profiles for the 13 African countries most burdened by HIV, TB, and malaria. And we all know, or for those who don't know, is that Her Voice Fund has really been critical in making sure that girls and young women improve not only their access to services where HIV and AIDS is concerned, or where TB and malaria is concerned, but really their broader health, their well-being, and supporting their rights when it comes to sexual reproductive health. A lot of the work that Her Voice Fund is primarily in Eastern and Southern Africa, and these countries have been specifically chosen because of the high burden that they have where girls and young women are concerned. It is supported and implemented by the global network of young people living with HIV, Y+ Global, who are doing an incredible job in making sure that we are always in line. And trust me, I speak as the country lead from South Africa. They know how to make sure that we do what we're supposed to do in advocating for the rights of adolescent girls and young women. I'm sure other country leads and grantees will agree with me. Why did we decide, or why did the project management unit at Her Voice Fund decide that let's do country profiles? Well, here's the reality, right? Is that when you're looking for information on the internet, desktop, or, when you go to particular gatherings, you very seldomly find information sitting in one portal when it comes to girls and young women and HIV response, prevalence, incidence, and many other things that we're looking for where girls and young women are concerned. And so this was such a great idea, because what it does is that it allows us a pot of information where now ourselves as country leads, grantees, other CSOs, other CBOs, partners, stakeholders can find and access the information that they're looking for. This is really important because the work that we do requires us to be backed up by data. We are not doing the work that we're doing just for fun or just to tick another box. We've got to make sure that we are responding to the needs of girls and young women, particularly in these areas. Now, this has been a desktop process, which included capturing certain information from individuals who've been working in the space through stakeholders, partners, ambassadors, Her Voice Fund ambassadors, as well as CCM representatives and other people that Her Voice Fund work with. And the reason why this was important that we do is because we needed to gather the data, right, on the prevalence of HIV, TB, and malaria, SRHR issues as well. We also needed a summary of what policies are in place, including age of consent, and things like access to health in particular countries. It's interesting to know that in Botswana, the age of consent would be X amount, X age, and versus South Africa or versus Tanzania. This is important information for all of us to know, so we know what we are advocating for if one country is doing better than the other. It's also for us to be able to analyze high-level national policies in these countries and to be able to take some of the work that is being done well and not reinvent the wheel. And because we know that a lot of the challenges that girls and young women face are similar in many respects, we're able to duplicate that work in our own countries. And really, in essence, it's for us to provide a picture of what girls and young women's issues, challenges, but also solutions are looking like on the continent. Also, just to give us a little bit of motivation, because as we can agree, working in this space can be really, really tough. While rewarding, it can be really, really tough. So today, we are launching the 13 country profiles. Can I get a whoop whoop in the chat box, please? Whoop, whoop. We are launching the country profiles today. This is so important. I need you to have an idea of the fact that this kind of information didn't exist before. And because of Her Voice Fund, for the first time in history, this information is now going to be available. If this is not legendary, I don't know what is. I mean, it just doesn't get better than this, people. And I really want you to think about it and really practicalize it, that now for the first time, you're going to be able to see what they're doing in Zimbabwe, what they're doing in Lesotho, what they're doing in Zambia, and for you to be able to go, like the work that they're doing, I can take a thing or two from there. And this is what this work is really about. And so without wasting any more time, before I introduce to you our other panelists, I'd like to, at this point, introduce Cindy Amaiza, who is the Her Voice Fund coordinator, to tell us more about the objectives of today's webinar. Cindy, over to you.
Thank you so much, Sibu, for bringing in the energy, for ensuring that people are riled up for this webinar. Thank you so much. So, as Sibu has already mentioned, that this is the first ever Her Voice Fund webinar. I know that we have conducted some other meetings, some other different channels and avenues, but this is the first ever Her Voice Fund webinar. So welcome all, and feel free to tell us everything in the chat box. Today is a significant day because we are going to be launching this 13 country profiles, and majorly we are here to, number one, showcase the updated country profiles. These country profiles have updated data and indicators on HIV, TB, and malaria, as well as SRHR. If you look at them also very well, they give a background about the gender-related barriers that are affecting AGYW in these areas, and are also showing the intersectionalities between these gender-related barriers, as well as how they affect AGYW issues in regards to HIV, TB, malaria, as well as SRHR. Something else we are here to also discuss, we are here to explore particularly how these country profiles are going to support us as grantees, but also support any other AGYW related programs. So what are those ideas we have in AGYW programming that we are thinking about? What are those advocacy areas that maybe we have been struggling with? And we can now also see what are these grantees in these specific countries doing? What are these other grantees in these other specific countries are doing? And see where exactly can we come in and support each other to achieve our advocacy goals. We are also here to ensure that we have access to these country profiles. I know that when they were developed, everyone was particularly, especially the grantees, were engaged, and AGYW from CCMs, AGYW from different areas were engaged, stakeholders, Ministry of Health, officials were also involved. However, they have not yet received the final one. So you're going to also get access to the final versions of these country profiles on the Y+ Global website. And these profiles are not only important to us as Her Voice Fund, but we are also going to be using this for resource mobilization. We are going to show that these are the issues that are affecting AGYW across these countries, and this is why we need funding, and this is why we need support in these areas, and this is why we need to advocate for specific issues in these areas. So Welcome on board, everyone, and I'm hoping to have a very vibrant webinar, and we are going to have a lot of fun as well as launch these profiles. Thank you, and back to you, Sibu.
Thank you so much, Cindy. I like what you said at the end, because in all honesty there, this information helps us as people working on the ground with girls and young women to be able to prove our case when we are applying for funding, to say, because of the data, this is what we need, you know. So this is incredible. I hadn't thought about that one, Cindy. So thank you so much for raising that, because I think very often we speak from the heart and, you know, we're passionate and we know what we're doing, but this is going to back up our work. So thank you so much for that. Before I hand over to the next speaker, I want to continue highlighting some people here who are joining us. Rejoice Moyo from Zimbabwe. Hello. Paul from Kenya. Tatenda from Zimbabwe. Atija from Mozambique. Hello, Sabina from Kenya. We have Gwenny from Zambia. We also have Cindy, you just spoke, but hello to you again. We have Deborah all the way from Nigeria. We also have Wills Marie from Mozambique. We also, lastly for now, we have Judith. Judite, I hope I'm saying this right. Please tell me, Judite, if I've said this correctly, from Mozambique. I never want to butcher anybody's name. Oh, my word. Next up, I want to now hand over to Oliver to talk to us, Oliver Muindi, to talk to us about what was the process? Because surely, you know, and a lot of us who are on here who are grantees or country leads, you know Y+ Global for process. They want to know process. They want to know thinking behind constantly. They don't want us to do things for the sake of doing them. And so I believe, Oliver, there was thinking, there was process when you guys thought about pulling this together. So please take us through the methodology of coming up with these country profiles. Over to you.
Thank you so much, Sibu. Oh my God, you guys are so high energy. You and Cindy, how to keep up now? So thank you so much. I know for most of our grantee partners, I'm always the ghost with the mails, but this is me, Oliver. So just to mention a few of how we went through the engagement, it was a lot because we had a lot of back and forth with the grantees, with the partners. I remember having so many calls with different persons that we engage in. So firstly, we had, before I got that, because like Harvest believes in having voices of EduYW put at the forefront of everything we do. So in this process, that was what was channeled. We channeled that to our partners and also the EduYW that we had direct contact with. So through this, we conducted interviews and we conducted sessions. I don't call them interviews because it was more of an engagement session. So we had sessions with EduYWs from some of our partners in country, which was a very engaging and very like eye-opening, because you get it from the people on the ground of what was happening in the country. So they were the biggest advisors of this document. And we also had sessions with some of the grantees partners that we have in country, where they also shared some of the challenges they experienced while they're doing their work under Harvest Fund, and some of the key successes that they managed to achieve also in countries. Then after that, we had session with the country leads. So as we all know, Harvest Fund has 13 country leads representing each of the country that we work in. And after having sessions with our country lead, we had the sessions through the country lead where they reached out to the in-country partners because they're the ones who directly engage them. So we had them have sessions with the Ministry of Health, with the CCM members, with UN agencies, with local administration in terms of health. And they also shared some of the engagement and experiences they've had with Harvest Fund on ground. So this said, majorly, what is influencing this document is directly from the ground of the persons who are influenced or who are affected by what is happening in their respective countries, and in relation to HIV, TB, and malaria, and how they see the engagement looking like, and how they wish the future would look like, and what can be made better, which is already working out. So that was majorly how we got to have this data. So all this was wrapped in a bow by a consultant who made it look this beautiful through also our design team, Tawanda, making this document come to life. Thank you so much, Sibu.
Thank you so much, Oliver, also known as The Ghost. I'm sure a lot of us are just happy to see you for the first time. Thank you so much for explaining that, Oliver. And I think what I'm taking from that is that really with this process, it has been, you know, top to bottom, bottom to top, just in terms of making sure that we get access to all the information that we're looking for. Because while we're the ones implementing on the ground, the role of, you know, government, ministers, UN agencies, partners, our donors are so important. And so it's really great that throughout this process, we were encouraged strongly to speak to all of these stakeholders, because they were the ones who were really going to put meat on the bones, you know, because we all have different perspectives of what Her Voice Fund is about, first of all, but secondly, of the work that we do with adolescent girls and young women. Others, it's policies and making sure that in particular interests of girls and young women are spoken of in certain spaces, whereas some of us are on the ground interacting with the girls and young women. So thank you so much. This just validates the fact that these country profiles have been well thought through, that it wasn't haphazard. We really wanted to make sure that all the information that needed to be in there got in there. So thank you so much for that, Oliver, and sharing that process with us. I want to keep highlighting some people here before I get into the crux and hearing directly from the people who were involved in the creation of the country profiles in their countries. I want to say hello to Josephine from Uganda, Shirat from Uganda, Tapiwa from Zambia, Carolina from Mozambique, Said Juma from Tanzania, Simpiwe, let me give you the hashtags again. Thank you so much. It is hashtag Y+Global, hashtag Viv Healthcare, hashtag Global Fund. Listen, I hope you've taken your selfie. I hope you've taken your selfie and that you have posted your selfie. I wish there was a way of me knowing who has posted their selfies, and maybe we can give a prize. Anyway, I hope you caught those hashtags, Simpiwe. I want to continue and say hello to Irene from Alma. I want to say hi to Anna from Shai as well in Mozambique. I want to say hi to Crystal Bonzo, who's from Zimbabwe, our Her Voice Fund ambassador. We'll hear from her just now, as well as Matseliso from Lesotho, Maureen from Kenya. I'm going to stop there for now, and hopefully I'll be able to get through everybody by the end of this webinar. But now I want to introduce our speakers for today. And I really want us to take the time to listen to these folks, right? Because they were at the forefront in their countries of creating these country profiles. They were part of the interviews, the desktop research, making sure that they're getting the right information. So these were the co-creators of this incredible milestone. And so I want to introduce to you, I'm going to give you all their names first, and then I will jump straight into asking questions. So the first person that I'd like to introduce today is Besta Mulenje, all the way from Zambia, former Her Voice Fund ambassador, as well as Gracious Lehwati. I haven't seen her though, so maybe she's still going to join in. Former Her Voice Fund ambassador from South Africa. Then we've got Phineas Musai, who's the country lead. Hello, my colleague from Tanzania. Then we've got Crystal Bonzo, current ambassador for Zimbabwe, Her Voice Fund. Then we've got Brenda Baku. Bye. Current ambassador from Kenya. And then we also have Dr. Advocate Dlamini Eswatini, who is the executive secretary for the country coordinating mechanism, Eswatini. So I want to go straight to Besta. Besta, what was your involvement in the process of coming up with these country profiles? Besta, going once, going twice, sold to Brenda Bakubai. Brenda, please give us an idea of what was your involvement in the creation of these country profiles? And then the second part to my question is, how are you going to use it now as the current ambassador in your country?
Thank you so much, Sibu, and I'm glad to be here. I hope I'm loud and clear. You can just give me a thumbs up. Oh, thank you. As the Her Voice Fund ambassador in Kenya, I'll start with the basics. My role has really helped me develop leadership and governance skills that have been really instrumental during this specific engagement of identifying and also building on the Kenyan profile at national level. And these specific skills have been instilled in me over time as the Her Voice Fund ambassador, being part of this process. And one of the significant things that I'd like to mention during this process that I played a key role in, together with the country lead, that is Y Plus Kenya, was one, the desk review that we did together. We were able to unpack different policies that are affecting the response of HIV and even TB in the country for adolescents and young women. And just to mention a few, the key policy that we had an opportunity to unpack was the sexual reproductive health and right policy, which gave really critical gaps. For example, the age of consent in Kenya currently sits at 18 years old in terms of testing. And mark you, when we look at the data provided as evidence with the National AIDS and STI Control Program, the numbers of HIV infection among AGYW is rising. We are currently sitting at 42%, especially for adolescents and young people. So you see, it's creating a lot of barrier in terms of early diagnosis and treatment. The other key policy that I'll mention was the Kenya Strategic Plan Framework for 2022 and 2025. With that, we were able also to identify the key alarming trends in the new HIV infections among adolescents and specifically children. And based on that, we also identified that the number of AGYW new infections are from the age of 15 to 24. So as a country, we are really having a lot of things we need to unpack and also focus on the critical gaps that we are facing in terms of the age of consent to HIV testing, especially for adolescents, girls, and young women. And in line to your question in terms of the opportunities that are there for us as a country that we can focus on in response to these specific gaps, we have started aligning for those opportunities that are currently being offered at national level. So in response to Her Voice Fund, we've had an opportunity to have 2 specific AGYW sitting at the National Technical Working Groups by the NASCOP. So NASCOP is, again, the National AIDS and STI Control Program. So we have like one of our grantee called Pauline from Moyote. She's sitting at the M&D TWG, and also the service delivery, we also have one, and also the sustainability of HIV response. So we've been able to make sure that we are aligning ourselves very strategically so that we can gain in terms of the opportunities that we have in the country. And also over the years, we've been working closely with the Kenya the KCM, the Kenya Coordinating Mechanism under the Global Fund writing, because they have an opportunity where they do budget allocation, budget writing, all of that. So we've aligned with them to make sure that young people do not miss out on those specific decision-making tables. And the beauty is that the young person that was elected to represent us was a young woman called Marianne. And during the process, we did a lot of FGDs to make sure that the request and the voices of young women are put forth during this specific writing, and also the grant making. And I'm glad to say that it has paid a lot of impact and fruit in terms of the funding and resources allocation. However, they are yet to get into the hands of young women. That is the other part that we are still advocating for, because we know they were allocated, but now we need them in the hands of adolescents and young women in terms of implementation and response of HIV. Additionally, just to summarize, because I know other panelists need to also highlight the specific things that they've done. We've been also advocating with the UN joint team, and we were able to get 14 AGYW to be part of the UN Women program that is dealing with adolescents, girls leadership, and HIV response, where they'll be able to be paired with the specific coach and mentor during their processes in advocacy, their processes in programming, and this gives us a high end in terms of leadership skills for adolescents and young women in the country to keep advocating for the specific needs. And the beauty is that majority of these young women, the 14 in number, are from Her Voice Fund program. Thank you.
Thank you so much, Brenda. Wow. So that was such a nice ending that these girls are from Her Voice Fund. Really shows the impact of the work and the fund has had on adolescent girls and young women. And I want to draw on some of the things that you said. So for example, you mentioned how the work doesn't stop, right? So just when you've crossed one hurdle, there's another hurdle to cross. The work never ends, because you speak about the fact that the funding was allocated for girls and young women's programming, but now the fight or the negotiation is to make sure that it now actually gets into the hands of girls and young women. So power to you and all the work that you're doing, you know, in your capacity, as well as the work Kenya is doing. And really, I'm glad that you've been able to use the country profile to navigate yourselves into spaces that are relevant and are important for the decisions that we need to make for girls and young women. You also mentioned how this has really helped your work around CCM, which we know, Dr. Advocate Dlamini, can be quite a difficult space to find ourselves in. Okay, and so when we are hearing from our colleagues in Kenya that they've been able to move really well with getting into that space, I want to now come to you, Dr. Advocate Dlamini, and ask, how will you, in your role as the General Secretary, the Executive Secretary rather, of the CCM Eswatini, will you use the country profile from Eswatini to further advocate for adolescent girls and young women programming Eswatini? Over to you. Dr. Advocate Dlamini? Going once?
Yes, good day, colleagues. How are you doing?
Thank you so much for joining us, Dr. Advocate Dlamini. Did you get the question?
I didn't know. I'm just in between meetings, but I'm here with you now. Please, can I shoot? What's happening? What's the question?
So we've been talking about how difficult it is sometimes in our countries, and we're so glad that we have a CCM representative here from Eswatini, you know, because
Sure.
as people working in the space, we find it's difficult sometimes to get into the CCM. So we are just, first of
Sure.
all, really grateful that you're here, because you're showing support for the work that we do, but also you have had access to the country profile Eswatini, and I want to know, how are you going to use the country profile in moving, motivating, negotiating for other adolescent girls and young women related programming for your country?
First of all, in terms of our statistics, we're not doing fine in terms of adolescent girls and young women. Our report that we have in terms of chemistry, you know, we have the survey that normally tells us as a country how we're doing in terms of new infections. So it is pointing out that we're not doing very, very fine. We've got about 4,000 new infection annually. And the population that is kind of like in trouble, it is the HYW and men. So if you're looking in terms of the demographics, so the young girls and young women, the adolescent girls and young women from 15 years to 25, they kind of like start dating the 45 and 55 men for reason that are known, because of social enablers, unemployment, you know, and of course, even all the peer pressure that these young girls possibly do have, you know. So that takes the statistics to be where it is today, where we say that they've got about 4,000 new infections that we normally have as a country annually.
Sure.
And like I've mentioned that the leading population to this kind of statistics is the HUYW and men. But let me stick to the young adolescent girls and young women. In terms of programming, there's quite a number of things that need to be dealt with, and I don't think it's a matter that has to do with Eswatini. It should be something that is in the sub-Saharan, and if not most of the low middle income countries, the issues that are facing, because this is stemming out from issues of economy. If our economy is not well balanced and etc., then we get such kind of kickbacks, issues that we find ourselves dealing with. So now, from a question in terms of programming, there's a lot of investment that need to be developed, at all levels, from political will, getting a political will that we're able to break barriers, barriers in terms of political will, because there are certain programs that you find that they are supposed to be attending to HUYW, but in terms of political buy-in, we don't have. So it has to be starting from there. We talk about policy, we talk about political elements, we talk about policy. Then we talk exactly now about programming to say that exactly what activities that need to be dealt with, which we're supposed to put up in terms of programming, and how much support that we have in terms of money to push those kind of activities, and so that we can start doing what we call monitoring, evaluation, analysis, and see how much impact we're able to do, so that we can learn from there in terms of understanding what needs to be strengthened over time. So one of the areas that I want to deal with, there's a population in our space. If I can be very much clear to you, in Eswatini, we have a population, particularly the one at tertiary level, the one that are in university, in the college, and etc. They are a cohort that is spanning with the issues of new infections. And the second cohort is the one that is looking for employment. And that the second cohort that is pushing up the numbers. So if I can pull up these two for you for now, these are the areas which we need to focus in terms of intensive programming for such kind. And programming that need to be comprehensive. It should cater for social spaces. It should cater for behavior. It should cater also for biomedical innovations, distribution, strategic way of distribution of condoms, prevention, issues of prevention, condoms, PrEP, and so forth and so forth. Strategic, designed, unique design program that specifically go to HUYW, because they are a sensitive population, and they are very unique products that are not designed for them. They just stay away from them, because, for example, from where I stand from SCCM, in terms of our principal recipient, we normally support the Ministry of Health in program that has got to do with HUYW. For example, if we want to talk about supplying certain commodities to the HUYW countrywide, first of all, even the vehicle that you're supposed to use, it has to be unique. It should be attractive the way you branded it to them. It has to be classic, and it should be able to be welcoming to them and so forth. So this is where we are to say that we need to strengthen areas of that nature. And also on top of having said that, prevention, and you move with the whole cascade, prevention, HIV testing, treatment, initiation, and viral load suppression, and etc. And also the other part that need not to be forgotten is issues of capacity building, training in terms of how they can be, one, self-employed, so that they cap down the appetite of unemployment, so that they can be skilled enough that they can start working and pushing things of their own. This is to talk about entrepreneurial dimensions. That's supposed to be part of such kind of programming. So, and also engaging them even to more to say that even for those that cannot able to read and write, we're able to kind of like build up their skills in terms of of taking them to schools where they can do handcraft and so forth, so that you keep them engaged throughout and increase their mind in all the, and also then protect them with very good, strong laws, against areas of GBV, because you find that they're also very vulnerable to such GBV, which is gender-based violence and all those kind of things, and some cases of rape. So we have very, 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 very harsh sentencing for such kind of men who be found to have dealt or did such kind of things to them. In summary, when you talk about UN, they talk about the 10-10-10, where you talk about that 10% of some countries in the world are found not to be having good laws that are protecting young women and also children around them. 10% to find that is it that kind of 10-10-10. So there's still a lot that need to be done. So in terms of advocacy, where I am sitting, I'm sitting in a very good space in CCM, because CCM is a central space. The central space is almost like a small parliament in a country, because everybody is sitting there, everybody has a voice, everybody has something to say. As I speak to you right now, in CCM, we've got young people that are sitting in there, the youth representing young people. We've got also young people representing people living with HIV. We've got also young people representing people injecting drugs. We've got young people that are found to be in the community of LGBTIQ+. All of them, they are sitting as CCM, making their voice towards the grants that we get from Global Fund. So that makes us to have an almost a 360 degrees approach in terms of how, when we do our grant application to Global Fund, that everybody is found to be having something to say, and in that small cake that we get from Global Fund, so we share it across the board. So in terms of advocacy, we do have that drive as a CCM for young people.
Dr. Advocate Dlamini, like, this has been so inspirational to listen to you, because one, the CCM is such an important, like you said, it's like a mini parliament, right? And it really holds the decisions to where the resources will go. And it is just so encouraging to know that the young people, the adolescent girls and young women, my colleagues from Her Voice Fund, the grantees, the country lead, has such a huge supporter in you. Thank you so much. And we really hope that the country profile in Eswatini is going to help further advocate and back up the work that you are already doing. And, one of the things that you spoke about, which is quite powerful, and some of the things that we're talking about now as a collective, is that girls and young women want money in their hands, because it gives them negotiating power.
Yeah.
And so it's so important that in the program ideation and implementation that we do at Her Voice Fund, that we are ahead of the curve where that is concerned, and we start creating programs and implementing programs that put money in girls' hands. That is what they want. So thank you so much for reiterating that and just helping us understand that that is something that the CCM Eswatini are also looking to do. Thank you so much for your contribution.
I appreciate it, my sister. Have a great day.
Thank you so much. I know that I've got Bester now and Gracious, and I'm going to ask both of you the same question, because both of you are former ambassadors representing Zambia as well as South Africa. And you were a part of the process in shaping the country profiles in your country. Gracious, I know you and I worked a lot on the country profile, and I know that Bester worked a lot on the country profile in Zambia as well. I'm going to start off with you, Gracious, and ask you, what unique perspective did you bring in to creating and shaping the country profile here in South Africa?
Thank you so much. Hello, everyone. I'm super excited to be here today to share more about this beautiful work of art that we created. And I just want to reiterate that this profile is not just a mere document, but it is a collaborative effort that captures the voices, the needs, and the aspirations of adolescent girls and young women across our different countries. So as the ambassador, my role was rooted in ensuring that the voices of AGYWs across South Africa were authentically represented in the profile. So I collaborated with the grantees, the community leaders, and the AGYWs to gather insights about the systematic barriers that they face, ranging from the high rates of HIV infections to gender-based violence to limited access to sexual reproductive health and rights. But most importantly, as highlighted by Dr. Dlamini, we saw that lack of economic opportunities lead these adolescent girls and young women to find themselves engaging in harmful behaviors and things that would make them vulnerable to getting HIV infections. So this profile, it's a culmination of all of these efforts, reflecting their diverse lived experiences, particularly representing particularly for those in underrepresented areas and rural areas. So this is a sort of a roadmap that will inform us, or that was informed by their voices. So during the process, this collaborative process, I worked closely with the grantees who provided grassroots insights and data, because as much as we can say that we know what's happening on the ground, but these are the people, the key people who know truly what is happening on the ground. And then after that, we went to engage with the government representatives such as the SANAC, the South African National AIDS Council, who then helped us to say, okay, since the grantees gave you this certain information and data, how can you align your profiles to the national strategies, such as the National Youth Prevention Strategy and the Gender-Based Violence Femicide National Strategic Plans? So after that, we then said, let's go back to our communities, to the communities and organizations and the other leaders who then brought the on-ground knowledge of the barriers of AGYWs that they face daily. And this way, some of the external partners, so that we can see if the information that our grantees have, how can we improve and how can we work together as community-based organizations. And then lastly, we went ahead to engage with our global stakeholders, because we have the 2030 Sustainable Development Goals that we need to reach. So we engaged our partners such as the Waki Health and representatives of the country coordinating mechanisms, who then said to us, okay, how can we ensure that your profiles adhere to the international frameworks, and that whatever that you put on those frameworks are actionable in terms of the global context. So that was just about it. And my role was just to bridge the gap between the stakeholders and the AGYW themselves, to ensure that the AGYWs and voices were at the center of the processes. Remember earlier on, I mentioned that lack of opportunities to economic development is one of the factors that the AGYW cried about. But then when we go to stakeholders, that is often overlooked, because they want to ensure that the programs that we implement meet or tick the boxes from whatever goals and plans that they have as the funder. But how can we go back to them and say, this is not what is happening on the ground? Girls need money, and so that they can protect themselves from these harmful norms. So we created listening sessions and consultations. So I facilitated sessions with AGYWs from underrepresented areas, which we got from our grantees who work in rural and coastal communities. So this was crucial in order for us to understand their challenges, such as the stigma, the lack of access to healthcare services, and the economic marginalizations. So with the grantees, so we have grantees like Kato Development Center, where we explored the programmatic insights from their victim empowerment programs and psychosocial support services to shape our understanding of these AGYW's needs. And then we worked with Horogo Social Investment, who host workshops focused on addressing adolescent sexual reproductive health and GBV. So these sessions were informed our aspirations for transforming the gender norms and reducing GBV. We then looked at the data and policy alignment, where we worked with the SANAC and other government representatives to ensure that the profiles reflected the key national strategies and the target that we have as a country, such as the 95-95-95 HIV goals. And then we engaged with organizations such as Waki Health, who emphasized that we need to align our priorities with the global advocacy efforts. Lastly, our approach was youth-centered, so we continue to partner with grassroots organizations like our grantees, like the Hair Pride Foundation, where we looked at some of the programs that we co-designed together that address the unique needs of the AGYWs in underdeveloped environments, ensuring that their lived experiences were reflected in this profile. So from our profile, we can say that the key 3 aspirations that came out was that we need to increase access to integrated HIV, TB, SRH, and GBV services. And then we need to transform harmful norms through engagement with men and boys, because often we say that this fund is only for girls and young women, but what about the people that they interact with daily in their communities and who are often called their perpetrators? So how do we include them, and how do we include them to ensure that our girls receive a holistic program that empowers them and also empowers the people that they engage with? And then lastly, it looked at expanding economic opportunities for AGYW to address these structural inequalities, because truth of the matter is, when girls don't have money, they become so vulnerable, and we can't ignore that they need money. We can't keep on going to the communities, giving them SRHR services without empowering them to have bread to eat at the end of the program. So how do we train them to become independent? Because independence is one of the most powerful things that a girl can have. So I believe that together, as I look back on this journey, I believe that there needs to be a powerful collaboration between us and the communities and the stakeholders that we work with to ensure that the voices of AGYWs, adolescent girls and young women, are represented. So I champion everyone who's here to champion this profile and support us and ensure that it is not only read, but it is acted upon, so that all of us here can create a world where adolescent girls and young women thrive, but most importantly, they become independent and they become transformed rather. Thank you so much.
Thank you so much for that, Gracious. That was really comprehensive in terms of the work that we managed to do together here in South Africa. So thank you so much for that. And I'll wrap up after we've heard a little bit from Bester about what the process was in Zambia and what your contribution was. Bester, over to you.
Thank you so much, Sibuleli. I was just impressed with what Gracia said, because most of the things she said was what we did. But one of the funny or most unique experience that we found was when we approached UNICEF, and these were the adolescent and HIV experts who told us that, you know, in as much as we are voicing out for the adolescent girls and young women, there's a community that we are not really getting to include in the programming, especially with CSOs, the CCM, and the PEPFAR, and these were persons living with disabilities. So during our interview with the HIV experts, they said that we needed to find a way on how SRH services, we're looking at the economic part or the economic sector of how we are delivering our Her Voice project. We need to find sign language interpreters. We need to find IAC materials that are going to speak directly to persons living with disabilities. And for me, that was a unique approach, because yes, we have these young people, but how is it that we are not really focusing on this particular group of people? So in our engagements, we had to have one of our grantees, which is the Hope Youth Network, that have a young girl that is actually disabled. She can't walk, but she always has a brother that takes her to the health facility to attend these sessions. And for us, that was a plus as Zambia, because we know we are including these people. Also, we were really honored enough to have the TYP, now known as the Zambia Youth Platform, that are part of the CCM, where Miranda is the CCM representative. And for us, it was easy for us to just have conversations with her and getting to find out how she's really pushing for the agenda for adolescent girls and young women. Just like the doctor spoke and Gracious, the issues of economic empowerment. This is every adolescent girl's conversation. They want money in their hands. And this profile speaks to that as well. Looking at some of the issues, I'm looking at some of the projects that our grantees did, and I'm going to speak on the youth platform, the Winning with Women and Girls project that brings about, that encourages and promotes HYW participation in HIV and SRH programming and policy implementation, which is also one of the things that I've noticed that we need to really push for our young girls to really understand the policies, because it's one thing for them to advocate for something minus not understanding the policies. So once they get to understand these policies, they know their rights and they know how to push for it. And I'm very grateful to her voice, especially when I was ambassador, that we had so many leadership trainings. And these were some of the things that they were bringing about. And I know for a fact that when people go through the country profile, I know UNICEF told us to say, we want to see the country profile once it's done. And I know they're going to receive it and see the contributions that they brought on board that is inspiring. And the young people themselves are going to be inspired. Thank you so much.
Thank you so much, Besta. Well, you can tell UNICEF that the country profile is now done and they will have access to it. And I love what you said about it is so important that the girls and young women we work with understand what we're advocating for, that they understand these policies and what they mean in their daily lives. It's all well and good that we are here negotiating, advocating, pushing doors open into these spaces. But if the very people that we are leading don't even understand or make the connection between their current challenges and what we are trying to advocate for, then there's really no point. So thank you so much for your work, for the work that you have done in your former role as ambassador of Zambia. And Gracious, you know, we don't stop, you know, and this is what I said to Brenda earlier, that we don't stop the work in what we're doing. And I'm so glad that you were able to be the gap between what government, UN agencies, other bigger organizations, as well as donor agencies have in mind of what the idea of what could be happening on the ground may look like versus what is really happening on the ground. So thank you so much for being that gap during the process of our country profile shaping and contributing. And also just for fighting and calling us into action there at the end in making sure that we support these country profiles and we make sure that they land up in the hands of the people who are going to need it. We are almost at the end of our conversation. And right now I want to chat to my colleague, the country lead of Tanzania, Phineas Musai. And if you have any questions, thank you so much for that. If you have any questions, please feel free to jot them down. I am going to try and get through to them. I still wanted to greet people. We still do have a little bit of time, but I'm going to ask now Phineas to please just chat to us about, do you have any recommendations, Phineas, you know, on how we can use these country profiles alongside our stakeholders, and perhaps a little bit of your process in your country in building this country profile?
Yes, thank you very much for the opportunity, and thank you very much for this engageful webinar we are having right now. It's great to hear from all other countries. More or less, the process was similar in Tanzania, whereby we engaged different stakeholders, because for a country profile to be that productive, for a country profile to be speaking about truly what the issues are regarding AGYW and how we have tried to support the AGYW within the nation. We had to engage them. So we involved people from the government, people from MOH, we involved from UN, CCM, where we call it TNCM, and other AGYW as well through discussions using their sub-grantees, Tanzania sub-grantees, whereby we got inputs that led to be inserted within the country profile, showing that yes, they acknowledge that there are services that have been given to the AGYW. There are support given to the AGYW regarding economic empowerment, regarding economic empowerment, education to the AGYW, issues regarding HIV, issues regarding them and because once we are supporting them, we're also not leaving behind the ABYM as well. So all of that was given, that acknowledged that that was being done, yet there is still more to be done regarding what we see is right now the current data within the nation. We see that we have the high prevalence ratio within the AGYWs, as this was done, this Tanzania Health HIV Impact Survey upon last year, whereby we are doing a lot, but there is still challenges. We have seen that there is also being mother-to-child transmissions. We have seen that there's been increase on issues regarding gender-based violence. So all of these issues are piling up, but it doesn't mean what we have been doing in the past isn't right, but it has led to the paveway where we are right now, and we still need to do more. So the country profile in general in Tanzania was through the involvement of those stakeholders, was saying that this is what has been done. This is what has worked well, but it's not been done in all areas within the country. There is still room to learn more. There is still room for us to employ what went well, for it to be used in supporting the rest within the country. Nevertheless, as your opening statement said, is that now having this document in our hands, this is very powerful for us, because we can use this to advocate on the issues that are already in ground. We can use this to show that this is what has been done, and we know what needs to be done. So we need your support. You say the girls want money, so we need that money for the girls, for them to be supported and cover all of these issues that need to be done. I think let me stop there.
Thank you so much, Phineas. And you bring to the table the honesty around the fact that COVID put us back a bit. And, the efforts that we had, seen, before COVID, just in that short space of time, halted a lot of our success, or, and while there's so much to celebrate, so much, as you so rightfully say, there's still so much more that we have to do, there's so much more that needs to get done. And so really, if we're to meet those targets for 2030, now is the time for us to pull up our socks even higher than what we did before COVID, because now we're playing catch up, and so in your country, for example, while you would have thought the issue of mother-to-child transmission might not be a thing nowadays, but here you are in a country finding that this is something that you are still having to battle with. So thank you so much for that sobering reminder that the work we see, but so much more still needs to be done. Thank you so much, Phineas.
Thank you very much.
As we close off the conversation with our panelists this afternoon, I'd like now to hand over to Crystal Bonzo, who is the current Her Voice Fund ambassador in Zimbabwe. Crystal, please tell us, how are you going to use this profile to further the work that we are all expecting you to do?
Hi, everyone. Good afternoon. So happy to be on this call and to be part of this very exciting and important conversation. I think, like all the previous ambassadors have shared the experiences, it's been the same, engagement, talking to AGYWs in our diversity, going to the the focal points to the hotspot areas, trying to understand what the real issues are. So that was also very exciting and a learning experience. But just to sort of like conclude what everyone has said, this country profile, I think it shows that we mean business as young people. You know, there is this misconception, even in the development space, that young people are, you know, we're not serious, we're not meticulous with our work, and we're always speaking about empowerment. So to have this is a testament that we're serious, we mean business, we know our communities, we have the facts, we have the information, and it sends a very bold statement to the global stage that young people are capable. So I'm happy that we've been able to have this country profiles that we're launching today. And it is going to further our work as Her Voice Fund in the different 13 countries, mainly because of the fact that now we can speak with authority on the issues that we talk about, because advocacy is great and all, but we need the numbers, we need the stats, we need the facts. And in doing so, especially with the shrinking funding space, resources are going to be channeled and streamlined to where they are needed most for the communities that need them the most. So I think that opportunity to have targeted funding will also mean our work is propelled in the different countries. And also, even in the national spaces, I can speak from Zimbabwe, where through these country profiles, we've been able to now be invited in like national dialogues like health financing, something that, you know, community-based organizations would not have, you know, dared to dream about a couple of years ago. So through these country profiles, I can just imagine, you know, one of our grantees getting into these meetings, speaking with authority. I think we're much more able to drive and push the narrative that what we are working for in our communities is real, it's there, and we can garner support from that. And obviously collaborations are going to probably stem a lot from this country profile, because I understand it's going to be shared widely, it's going to be available on the website. So even collaborating with other UN agencies, local governance, just to push the agenda of AGYW neurodiversity. So I think the work is just starting, and I'm happy that the country profile is something more of like a knowledge production management, that even for the grantees who probably might be weaned off Her Voice Fund, other incoming persons can still carry forward that, and then you have that longevity and the work will still propel. So thank you for the opportunity to be part of this, and I'm so excited to see what more we can achieve collectively as young people. Thank you.
Thank you so much for that, Crystal. Really appreciate your input there. You know, thank you for practicalizing what the profile is going to do for grantees. You know, you are so right. Nothing like walking into an environment or a space where you're already the underdog, but man, you're carrying the profile that has the stats and the facts and the numbers, and you're like, I know what I'm talking about. And all of a sudden people are like, You know, so if young people, we want to be taken seriously, we've got to take ourselves seriously. And so I think here the call to action is that as young people in our respective countries, let's look at these country profiles. Let's read them. Let us understand what they're saying for the work that we're doing day to day, so that when we get to these spaces, we make meaningful noise with the things that we want to get achieved. So really want to push the fact that hashtag Her Voice Fund, hashtag Viv Healthcare, hashtag the Global Fund, hashtag Y Plus Global, hashtag We Mean Business. So thank you so much, Crystal, for that. Really appreciate it. And thank you to all our speakers today. I hope I haven't left anybody out. I don't think so, or else I would have done a really bad job at this. So I really want to thank each and every one of you who have taken the time to be on this call today. I know that we've got representatives as well from the Global Fund, Hillary Nkulu. We've got Eva from Tanzania. We've got so many people who have joined us from Lesotho, Nawina from Zambia. So many people. Thank you for just being here and holding on this conversation with us. I see you Roots in Zimbabwe. I see you Wambui from Kenya. I'm just trying to scroll down now to see that if there are any questions that I need to be addressing and to whom, because I think we do have time for at least one question. Yes, well done to all our speakers. Thank you so much for highlighting this. Thank you, Wills Marie, for acknowledging all the great work that has been done. We see you, Maximina. Hello. So thank you so much for joining. I don't know if this, so Kevin says the advocacy aspirations for the HOIW in country profiles are indicative that HOIW in all countries have similar issues they're advocating for. These documents are key to policy change, service delivery, donor funding, and countries making health budgets properly allocated and utilized. Oh my goodness, Kevin, that should have been my closing remarks. I mean, how does it get better than that? Thank you so much for that contribution, Kevin. That's really, really appreciated. We see you, Unolali, in South Africa, in the Eastern Cape. So thank you so much to everybody. And now we've come to the time we've all been waiting for. Tawanda, please share the screen. And I'm going to need, if you can, please unmute yourselves. I know it may be noisy and that's okay, but I need us to count down together, okay? And make this like a global countdown to the launch of these country profiles, the first of its kind. You do not understand how exciting this is. So I'm going to ask you to please unmute yourself, and I want to need us to please count down. All right? Can you please count us down, Tawanda? Don't drop me now. Don't drop me now. Let's go. Let's go. I need you to unmute yourselves, everybody. I need you to unmute yourselves. Unmute. Let's count. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Wow. Woo.
The country profiles are now live on the podcast global site. Very good. Well done, Tanzania. Well done, Lesotho. Well done, Botswana.
You're a good soldier, choosing your battle. Pick yourself up and dust yourself off and back in the saddle. You're on the front line, everyone's watching. You know it's serious, we're getting closer, this isn't over. The pressure's on, you feel it, but you got it all, believe it. When you fall, get up, oh, and I fall, get up, Tamina, sangalewa, 'cause this is Africa. Tamina, sangalewa, this time for Africa.
Word. And to think that girls and young women, youth leaders, powered by Her Voice Fund, Y Plus Global, Viv Healthcare, the Global Fund made this possible. Congratulations, everybody. Yes, please do keep your comments coming in the chat box. This is amazing. This was a lot of work across 13 African countries. This is, when you think about it, it is so impossible, but it has been done. It has been achieved. Welcome, congratulations rather, to every single one of you. Special congratulations to the people who led it on the ground in these 13 African countries. And thank you so much to the project management unit at Her Voice Fund, powered by the Y Plus Global, for trusting us and believing in us that we were able to do this. And of course, we wouldn't be able to do this without the help of our donors. Thank you, thank you, thank you. Shout out to you, Viv Healthcare. Shout out to you, Global Fund. You have put your money where your mouth is. in the hands of girls and young women, in the hands of youth leaders. And this is what you get when you do it. Thank you so much to each and every one of you for being a part of today. And we hope that you are able to use these country profiles to further garner support, to advocate, to validate, to encourage you and all the young people and girls and young women that we work with. Thank you, thank you, thank you, and have a wonderful day further. Yay! Woo-hoo!
Thank you so much, Sibulele. And just before we leave, one last thing. If you are excited as we have been to see the country profiles, I just want to remind you that it's on the Her Voice Fund section of 4Plus Global website. So you can already go there and see if I know all your profiles are already there, all your work that you have been able to achieve is there. We have already recognized you. So you're just going to see how to get there and to be able to access this. So Tawanda, over to you.
Thank you so much. And Tawanda's taking us through right now and showing us exactly where you will find the country profiles under Y+ Global. It'll be under the Her Voice Fund tab, and you will see all the country profiles, and you are able to, you guys, just shut it down. Like, top tier, man, top tier. Well done, everybody. And can you please share these across our social media platforms? This is huge. You want to be the first one to have taken it out in your country.
All right.
Let's lead. Let's lead where it matters. Thank you so much, Cindy. Thank you so much to the whole team. All righty.
Thank you so much, everyone.
Bye.
Bye.
Bye, everyone.